Good afternoon, everyone. My name is Heather Evans, and I'm the Managing Director of the Community Living Ontario Foundation. I'd like to welcome you to today's webinar on technology-based solutions for medication management. We'd like to extend our thanks to our presenters, Ahmed, Jennifer, and Helen from Seamless Care Pharmacy, our pharmaceutical strategic partner with Community Living Ontario for the past few years. Seamless Care Pharmacy has been proudly serving communities for over 21 years, and they are continuously researching for evidence-based best practice and incorporating the best tools to help you with your work. We look forward to our continued partnership and this presentation today, but before we start, just a few housekeeping items to run through. All attending microphones are muted, but we encourage everyone to ask questions to the question panel, and we'll leave time to work through those at the end. The webinar will be recorded and available shortly after the presentation. And without further ado, I'd like to hand things over to Ahmed to kick things off.
Thank you so much, Heather. Thank you, everybody, for taking the time to join us in this discussion today. We're going to make it very worthwhile for your time. We're going to really talk about the research and development initiatives that we've gone through within the DSO sector, and talk about specifically about the technology-driven solutions to address the complex challenges that are facing the developmental sector. So first off, I'm trying to just switch slides here. There we go. Not too far. Yeah, so first off, we're going to look at the potentially dangerous situations care providers find themselves in. Helen will deep dive in the wonderful world of medication management and talk about the best practices to create a safe and effective medication practice that is outcome driven within the communities you help serve. And related to this topic is the way data is recorded and shared, and help make data-driven decision making and improve visibility and accountability. Jennifer Tran, she's a registered nurse and product owner of the Emr system at Seamless Care. She'll jump into the how Emars, like the reasons why Emars are a must for any organization trying to accomplish a safe and effective medication management practice. And then Jennifer will switch gears to talk about the training and education challenge that is facing the DSO sector, and talk about some of the best practices required to make sure the team is updated with the most relevant compliance when they're doing their medication administration workflows. So without further ado, I'll pass it over to Helen Huang. She's a doctor of pharmacy. She's also the designated pharmacy manager at Seamless Care, and she'll get into here the medication management piece. Go for it, Helen.
Perfect. Thanks so much, Ahmed. So for our first section, we'll be talking about how compliance packaging can reduce medication errors. So error is human. In the United States, medication errors are a leading cause of mortality, and 21% of medication errors are due to dispensing errors. Now, dispensing errors are both traumatic for the patient and also everyone else involved. That includes loved ones and also the pharmacy as well. These dispensing errors are often due to error-prone systems. So in terms of compliance packaging, errors can arise due to long repetitive workload, noisy cluttered workspace, or lack of proper medication storage. In community pharmacies, typically the person that is in charge of assembling your compliance packaging is not just tasked with one duty. You can imagine in a community pharmacy the different types of duties that they have to do. So for example, if you drop off a prescription, they might have to enter the prescription in for you. They have to fill the prescription and they have to cash you out. You can picture now how complex that can be when they're trying to assemble your compliance package while trying to juggle all those other different tasks, and that can create errors. Also, sometimes the space that they use to generate your compliance packaging is very small, and so they're cramming a lot of things in while they're trying to make up your compliance packaging. There's also 10, 20 different types of medication bottles they're grabbing from, and that can cause errors as well. We found that when you incorporate technology and space, it can really help alleviate those types of stresses for the pharmacy and help balance heavy workload. So in the end, they're dispensing an error-free product. Building safer medication management system. Compliance packaging is a medication management tool that is used to help with adherence. Now in Canada, looking at statistics, over 70% of Canadians are reported to not take their medications properly. And we really see that the rate of non-adherence to medication increases with the number of medications they're taking. So when they're taking one medication, it's reported up to 40% aren't taking it properly. And by the time you reach all the way up to 4 or more medications, that rate goes up to 70%. Compliance packaging is able to now increase their chance of being adherent to the medication, because when you put medications in compliance packaging, it has the date on there, it has the time on there, so it acts as another reminder for them to remember to take their medications. And this ultimately improves patient safety and health outcomes while reducing the medication administration errors. Now you can imagine if someone has 5 different medication vials, and normally medication vials are the typical way that a pharmacy would dispense medications, it's very hard for you to see, like, if your vial is full with medications, if you've taken it for the day or not. The only true way of you knowing is actually pouring out and then counting it every single day, which is a large task to do. Compliance packages are often offered by pharmacies, as you can see, is first, blister packs are the most common that you see from chain pharmacies or independent pharmacies offer this. And then you go to your specialty pharmacy, which then also offers the option of pouch strips. At Seamless, we offer both options. We have technology that's able to produce medication pouches and blister packs, and we encourage you to find a pharmacy that might be able to offer both, because depending on your agency needs, sometimes that might be the best solution for you. What we're seeing with our agencies is sometimes they would have their clients daily medications and medication strips to help save space, but then they choose to have their PR medications in a blister pack to make it very distinct, so they know that it's not part of their daily medication. Looking at the benefits of compliance packaging, we'll go into the 2 main types. So the benefits of having medication pouches, we found are usually recommended for group homes or when there's several people living under the same roof. Just because, again, it's very small and easy to store. As you can see on the photo here, and also actually have a live demo of it as well, there are these clear square pouches, and you can see how compact it can be. At Seamless, we also offer a dispenser as well, where you can properly store your medications. So especially for group homes or agencies that don't have a lot of medication cabinet, you can see how this can provide you with a compact way of storing your medication. Each of the medication pouches also has the client's name, it has the date and the time they're supposed to take it. It even breaks down to what medication is supposed to be inside the strip, a description of it along with the number of tablets this is supposed to be inside. And you can see when you also do your counts as well, because it's clear, it's very easy for you to see how the medications look like and for you to be able to do your counts. Another benefit from having medication pouches is the ability to generate unlimited pastimes. So you're not confined to just 4 pastimes. If your client are on multiple medications, this is when it really comes in handy, or when there are certain medications that have to be parted at a minimal amount of time together. Then that's when it really comes into factor, where you're able to then customize the pastimes to your client's needs. The medication pouch is also relatively easy to open. It does require a little bit of dexterity. Some benefits to blister packs is usually we see these used for individuals that are quite independent with their medications, or they're not on a lot of medications. Similar to the medication pouches, our blisters that I have a demo here also allows you to have the option of adding the client's photos. And we found that adding photos really helped with our agency needs, because this is especially in the case of an agency staff, like, or a part-time staff working, they might not be familiar with every single client in the home. So for example, you have 10 clients residing in the home, and maybe 2 of the clients have very similar names. They're both Robs. At that point, it's very hard for them to differentiate who to give the medication to. So having the photo, in addition to other identifying practices that you have in place, that can help effectively eliminate any chance of them giving the wrong medication to the wrong client. As I had mentioned here, the blister pack has 4 pastimes. So they have breakfast, lunch, dinner, and supper. And this is great for individuals that don't have a lot of medications. It's also quite easy for you to examine medications as well through this clear blister bubble. And it is quite easy to open. It does require a little bit of strength for you to be able to pop out the blisters. You also want to find perhaps a specialized pharmacy that adds a little bit more to their blister packs, either it being creating them a little bit larger so that you can see the blister bubbles a little bit better, or what we have at Seamless with our blisters is the ability to actually tear off the blister. So this is really handy for when the pandemic is over and we're able to go out and see our loved ones. If you have an individual that is going to be going out for the day to go home, instead of telling them to take the entire week's worth of blisters, you can then just give them the day's worth, and you can just tear it from the bottom, the day's worth of that medication, and they can bring it with them. So this again helps with reducing the amount of medications they have to carry, and also helps with reducing the possibility of them forgetting to bring the medication back to the home. So in Seamless Care Pharmacy, we utilize a lot of technology, and we do that in a manner because robotics really doesn't suffer from human errors, and it helps us produce error-free compliance packaging. It also provides us the ability to do a larger volume and give us the time and space to focus on the clinical needs of your clients. Our technology here also allows us to detect pill size, shape, color, quantity, and therefore improving our quality assurance. Our medication pouches also undergo another device that is able to digitally take photos of every single pouch before it leaves the pharmacy, and it is then stored for us to be able to provide traceability. So now moving forward, I will be passing the presentation over to Jen, who will be talking to you a little bit more about electronic documentation.
Thanks, Helen, for the introduction. So again, today I will be talking about how technology has changed and improved our healthcare system and capabilities of an electronic system. I'm sure a lot of you guys have heard the term e-health, but for those of you who haven't, e-health is an overarching term used to describe the use of technology in the healthcare sector. Some examples include an electronic patient management system, which helps with day-to-day workflows of patient care and storing of medical records. Another example is an electronic messaging system, which can help with secure and private messaging to the circle of care via fax, instant messaging, text, emails, which we use every single day, and e-prescribing, which has become a very popular add-on these days, especially during the pandemic, where prescribers are able to send prescriptions directly to the pharmacy, to the client's choice of pharmacy as well, and get their medication without the fear of losing the prescription or not having enough time to go to the pharmacy. A lot of the clients that we work with struggle with accessibility, or they have a lot of other competing priorities like appointments and other activities of daily living. So this type of technology has become really popular. Many of these items that we use today have saved a lot of time for both organization and healthcare professionals and even clients. Technology has really helped with the reach for allowing organizations to service many more clients and clients who are unable to access care. I'm sorry, I don't know how to change this. There you go. Sorry about that. Having some technical difficulties here. So now I want to talk a little bit about COVID-19 and how it has really brought to light a lot of gaps in our system. Everything that we had to do had to change. Business models were rearranged and reinvented. I know no one would have wished the pandemic to happen in our lifetime, but COVID-19 has really triggered years worth of innovation in the healthcare sector. And within a few months, it gave us the opportunity and obligation to think collaboratively about how bringing healthcare into the future needs to happen now. Many agencies has had to adopt digital health tools for virtual care and apps that give clients the access to their health information and results. So like when we think about COVID, we think about swabbing or even the ability to book an appointment to get our vaccine. So like for those of you who have had the vaccine or who have gone to swabbing, you know, the ability to get your results online is such a time saver, and it also provides like that you know, the security that we were looking for and the convenience of not having to like wait for that phone call to see if, you know, we're positive or negative, but we're able to just self-serve ourselves and get that information when we need it. So many organizations have transitioned to a work from home model, and essentials worker only on the front line. So for the rest of the team that does work from home, this has kind of reduced visibility for, you know, a lot of managers or, you know, directors and things like that to be able to see what's happening on the front line. But with electronic medical records and documentation, it creates ease of access to the frontline organizational operations for management. So this allows us to continue to do our jobs even when we're not physically there. Digital health is transforming the way healthcare is delivered across Canada. So now I want to talk a little bit more about the electronic medical record system, most commonly referred to as an EMR, and the abilities that usually come with an EMR. So one of the first things I want to talk about is secure storage of protected health information. So this is a very useful function. The idea that we no longer have to find a place for all those notes, medical records, and paper charting is really a blessing. There's so much paper that goes into a client's file, and then also the organization of it. It can make things a little bit difficult to find, and when you really need information on a client, it really takes a lot of time to dig up that information, especially if it's from years ago. Another ability of an EMR is progress noting. So this is a function that staff can use to document details of care, which can include documentation on hospitalizations, communications to family, to the circle of care, family visits and outings, leave of absences, any medication changes, doctor's visits and appointments. And this gives staff the organization the overview of a client's progress and journey throughout the healthcare system and their life, especially during their care with you. Another ability I want to talk about is assessments. I know on paper charting, we do have, you know, templates that are commonly used when, you know, a certain intervention is done. But the good thing about an EMR is that we also are able to create templates for staff to use when they are completing some sort of intervention or assessment. So for example, we use these during like bowel movements, when we're assessing skin, or when somebody's having a seizure, the administration of a PRN even. So assessment templates ensure that staff are documenting thoroughly and hitting all the points that are required from a ministry standard and best practice, which can really help with any accreditation and just increase quality of care. With electronic EMR as well, there's the ability to not allow staff to really to stop charting when it's incomplete. So with electronic EMRs, you're able to ensure that all fields are filled out and that there isn't incomplete documentation. Another ability of an EMR system is appointment tracking. Think about all the times that a client may have missed their appointment, or they weren't ready or prepared for their appointment. So something, you know, going to a hospital and having an ultrasound, or having some, you know, any sort of, you know, appointment that that you need to prep your, for example, bowels for, or you need to drink a full glass of water, or you need to fast before you go to this appointment. There's a lot of times where people lose track of these appointments and lose the information that is required for them to actually prep for the appointment. So with appointment tracking electronically, you're able to upload documents up to the to the appointment, and you're able to really get any reminders for it, and you can see all the information that you need that is required for that appointment. And this can help with arranging for transportation for clients and help them prepare for any procedures that they may have. Electronic medication administration records are also a very huge component of EMRs. Some EMRs don't have it, so it's important to look for an EMR that also has the function of an EMR, but I will discuss the functions of an EMR later on. And the last thing I want to talk about for the capabilities is the medication history. So part of an EMR, you're able to see a lot of the times the medication history that a client has gone through or has used in the past. So this is an easy way for staff to track changes and pull information without having to reach out to external partners to retrieve information. So this really does decrease administrative work. There's a lot of times when I'm working and, I won't have time to call the pharmacy or to wait to speak with, another staff from a different organization, when if I have the information on hand, it's something I can do at my own pace, and it's not something I have to wait to get that information. So being able to pull that information right, within the organization is a very helpful tool, which really increases efficiency and decreases administrative work. So all these abilities combined creates a full picture of what is needed in order to care for a client all in one place. You're able to stay up to date with a client's progress and their journey, which will create high quality and personalized care. So next, I would like to talk about Emars, but I'm having a very hard time changing the next slide. Sorry guys, bear with me here. Helen, do you mind changing the slide for me?
It says Helen's offline for me. If you have your own copy of the slide, could you maybe share your version?
Oh, yes, I can pull that up.
Let me make you the presenter now.
Pardon?
I'll just make you the presenter so you can share your slides whenever you're ready.
Oh, awesome. Are you able to see the slide now?
Yeah, we're seeing the presenter view though, so we see the countdown.
So what, you can see it?
Yeah, we can see it fine.
Okay, awesome. Sorry about that, guys. I'm having some technical difficulties here.
We're seeing your Word doc now. So if you under share screen, if you press the drop down menu, you should be able to select the slide deck.
Okay, I'm just gonna have to do this then. Can you see my screen, Ronald?
Yep, all good.
All good. Okay, back on track, guys. Okay, so sorry about that. So now I want to talk a little bit more about switching to Emars and how it will help you. So paper Mars have been around for a very long time, and documentation has been, it varies from setting to setting, but I'm just pulling back from my experience in South Lake Hospital back in 2011. And they were still using paper charting for progress notes and assessments. And like I could not believe it because they're a hospital and they were still using paper charting, which was really difficult to really find a person's chart. And then also like the fact that you have to share with another person one physical chart versus having more than one access from person to person. So that was also very difficult from a time perspective, having to wait for a person to be done with the chart in order for you to start documenting yourself. So with an EMR, which is electronic medical or medication record, administration record, there's permanent tracking of all medications given and by whom, which will increase the accountability of the workplace. So again, you're able to do to write down which medications you're giving and the person who gave it. This will all be documented electronically, and you don't have to worry about the loss of records or not being able to find that permanent record of things. EMRs also help with the management and visibility, help with management with visibility, and are able to check and track staff, understand their workload by seeing what still has to be done and completed or what has been done already. So with EMRs, management is able to pull that up and they're able to see like live view of what's happening on the front line and to see which medications still haven't been given or which ones haven't been signed off or which ones have been signed off or has, just being able to take, just to keep track of what is happening on the front line, which is a very helpful tool for management to really, see what's being done on the front line. EMRs also help with the reduction of errors related to medication administration and transcribing. So with EMRs, all medications that are provided by pharmacy will automatically update the medication lists and the MAR in real time. Not all EMRs do this or EMRs. So it really depends on the one that you end up using. But with the ones that we have, we are able to update that list live, which really helps with that communication also between frontline and pharmacy, and will help with the reduction in interpretation error or any errors related to transcribing, because the pharmacy will be able to input it directly for you and you will have that information instantaneously. EMRs also assist with staff in going through the rights of medication while they are actually signing off the EMR as well. So, the different rights of medication, such as right person, right time, right dose, things like that. And the EMR will help with having all that information accessible and easy to read, which will help staff be able to go through those things before they actually administer. EMRs also help with the administration of medications in a timely manner. Because the way EMRs are organized, it's easy to see which medications or how many clients have which medications due at what time versus having to like sift through pages of paper and then having to really look at, okay, so there's an 800 medication due here, and then on the next page there might be another 800 med, and then you have to do that for all the clients. And unless you know your clients really well, knowing which clients have medications at a specific pastime is really difficult to do, which can create a lot of stress and difficulty for a lot of part-time staff or casual staff who may come in just for a shift, right? So it's very important to make sure that your all information is organized in a way where it's easy to read. You have all the information that you need to give medications at that time with the reduction of error. So with an EMR, you're able to have that organized for you, and you can properly manage your time a little bit better and reduce errors. Another thing EMRs help with is timely and thorough documentation of interventions that have been completed as well. So staff are able to document as they go in a quick and efficient manner. They don't have to carry around pieces of paper and leave around. And they can, with paper too, like you have the risk of leaving that around, which may lead to like HIPAA breaches or lost pages. And then you lose that permanent tracking of which medications have been given. So, and then also again, like I mentioned, like having to share paperwork, right? Like that's also very difficult to make sure that your documentation is done thoroughly and timely, especially when you're sharing one paper record with multiple people. And with paper MARs, again, it's sometimes it can be difficult to read other people's writing, and then it can get very messy because multiple people are writing on this EMR, depending on how often you have your EMRs delivered to you. If you have an EMR for a couple of weeks, it can get a little bit difficult to read and it can get a little convoluted. So with EMRs, it's clear, legible documentation because it's electronic. You don't have to worry about someone's bad handwriting, and that timestamp of who did what at what time and what day is also tracked as well on an EMR. So since I have talked about, what types of functions are available for on an EMR, I want to talk now about like what does it really do for your organization. So the benefits of an EMR system is that it increases communication between healthcare teams, both internally and externally. So there are many times where, like I said, finding information is very difficult, or, if you have to go and fax something to another external agency or partner for referrals or for hospital records and things like that, it can be very cumbersome to have to go through a paper chart to go and find that record from 5 years ago. With an EMR system, you have access to that information when you need it, and this helps with keeping everybody on the same page, because again, multiple people have access to it, and it's just easy to find. Having an EMR also lowers administrative burden, so things like file sharing, information across departments, faxing, uploading old documents, and converting to electronic copies. So with an EMR, a lot of things are emailed now. A lot of things you can just save electronically online, and you don't have to worry about that printing. You don't have to worry about having to fax that physically and things like that. So with EMR systems and safe and secure communication between teams, you're able to send that directly to an email or even electronic faxing as well too now. So ultimately, it reduces administrative duties and helps healthcare providers work more efficiently in reducing burnout, but also giving that time back to healthcare providers to, dedicate to more hands-on care for clients, which ultimately results in higher quality and personalized care. EMRs also help with the reduction of errors and guide staff to avoid mistakes. So we talked earlier about, how staff are able to go through those rites of medication administration before they go and give a medication, or even, when you're doing an assessment. There are times where I have done, like a skin assessment, but, after I actually document on the assessment, I don't really see, all the points that I need to answer for my documentation. But, while you're doing it physically, you just think about, okay, you look at what you're looking at and you don't really remember which things you have to document on until you actually pull up the template. So that helps also with, avoiding mistakes, that you're dotting your T's and you're crossing your I's when you are doing completing assessments and interventions for clients. Emrs increase the visibility for a client's progress, and it is viewable 24/7. So again, COVID has really affected us all, and there's a lot of staff who are working from home. So being able to access a client's record from home 24/7 has really helped, especially in community sectors and long-term care. Management is able to physically see what's happening on the front line from home, which really helps them to guide staff if something happens or an error occurs, that management is able to really support staff even though they're not physically there at the facility. EMRs increases ownership and responsibility of all staff. So because there is a visibility and tracking of all interventions completed or not completed, this really sets the standard and the tone for staff, and letting them know that everything that you do will be documented versus, it's very easy for paper, for you to just sign off when you have the time versus, using an electronic system. Everything is tracked, the time and the date of when things were inputted. So this really calls staff to really meet a higher standard when you implement electronic management system. Standardization of record keeping and assessments and documentation also come when you start using an EMR. So how many times have you guys read documentation that was missing pertinent information of an incident or an intervention that resulted in harm to a client? Templates allow for staff to hit all points that they need to during an assessment, bringing attention to all items that any items that they may have missed, and all information that is required from a ministry standpoint and policy. So again, that standardization across the agency, right? Some staff may document one way, another person might document a different way. So with standardization and templates that allow staff to document consistent information, but also the standardization of record keeping, you know where to find it, you know which documentation you need to fill out, and it's all accessible and stored safely. Lastly, EMRs will ensure that your organization has the records it needs when they are needed. So real-time access anywhere, anytime. And this can help with accreditation, random ministry investigations, incident investigations, and the ability to share with other healthcare providers during handoffs. So like 24-hour shift reports or referrals to a different community service. So all this information will help you address and identify gaps and improve practice and quality of care. So the goal and the impact of eHealth, it really does help organizations to provide quality care. And in order for us to continue to do this, we have to adapt and change with the future of healthcare. That means learning how to integrate technology into services in order to keep up with the demand and the standard across Canada. Because of the demand for an electronic documentation system and EMR, we have actually created one specifically that tailors to the DSO sector. Our team continues to receive input from partners like you, and we continue to do our research on the needs of the DSO sector so that we are able to provide that specialized product for you. Electronic medical records not only will increase quality of care, but also as an organization, it really keeps you as a leader in the sector, and the organization is able to service many more individuals in need. So now I want to hand it back to Helen and she is going to talk a little bit more about the benefits of e-modules and virtual training for the DSO staff and the education portal.
Perfect. Thanks, Jen. So now we are at our last segment for today, which talks about technology and standardizing and organizing staff training. Next. Controlled Acts training. So you might all be very familiar with the RHPA Act, which is the Regulated Health Professions Act, and it was developed to protect the public interest by setting forth a variety of standards, which include defining scopes of practice and controlled acts. And controlled acts are procedures or activities which may pose a risk to the public if not performed by a qualified practitioner, and only certain regulated health professionals can perform them. Now, that is unless that controlled act has been delegated to the person by a member authorized by the Health Professions Act, such as a doctor. So we see this being used a lot in group home setting, whereas we have direct support staff that sometimes don't necessarily have a medical background. And in that case, we have to really make sure that we are providing them with the appropriate amount of education, and so that they are equipped with the knowledge to be able to administer these specific medications for your clients. Next. So how can we use technology to better educate and train our staff? In order to ensure that you have standardized training, everyone should be using from the same platform. And what this allows you to do and use technology is to be able to have a far greater reach and to help facilitate and organize to make sure that all your staff are trained and they're all at the same level. Next. Therefore, we recommend using a program that is incorporating both knowledge and also making it interactive. Based off of our past experience, we've had in the past, including in our education didactic lectures or hour-long YouTube videos that just wasn't very engaging. It was very long. It was very hard for them to retain their knowledge. Instead, what we had done now is upgraded our e-learning module to incorporate more interactive methods, because depending on the individual learning, everyone has a different learning style. So we are able to interact with our users with using a different variety of learning methods, such as reading, watching short little videos, completing quizzes and tests. Inside an e-learning module, there should always be questions embedded within it. What this helps with is making sure that first, they are engaged. Second, it really helps build their confidence in order to retain the knowledge that you're trying to teach them. An added benefit of using a centralized e-learning program is that now your staff, again, their training is standardized and they're able to access the information when they need it. As a management, you also want to look into training programs that are able to be tailored to your needs. So every organization always has different training requirements. Not everyone's going to use every single controlled act, which is your diabetic devices, your suppositories, enemas, inhalers, and nasal sprays. Maybe some of your homes only require the nasal sprays, or maybe some of your homes require more than just a controlled act. A perfect example of that is if you're bringing a client in to see a doctor and they're on blood pressure medication. If their blood pressure is a little bit high, the doctor might decide to increase their dose. And a common request that doctors may ask the home to do is, well, can you track for the next 2 weeks their blood pressure? And then send that information back to me, and we can see whether or not this change was effective and beneficial for the client. And there we have an assumption that the staff is able to do this properly. What we've come to know is that there are a lot of gaps in terms of knowledge providing and sharing that we are able to provide agency staff. And so you really want to work with a education portal or platform that's able to accept requests and able to generate these modules in order to facilitate that knowledge sharing with your staff. So in terms of, that was a very specific example that had recently happened at Seamless, where an agency had reached out because they don't know what are the specific requirements in order to measure their blood pressure accurately. And we were able to build that module for them. And now they're able to incorporate that into their policies and procedures for any staff member that needs to measure blood pressure for their clients. Ideally, the program that you're looking at also should have a diverse list of available training courses in addition to your basic controlled acts training and the ability to customize your own training courses. They should be able to readily adapt to the changing environment. A perfect example is during the pandemic. They should have courses available of how to teach your staff how to properly don and doff PPE. Lastly, we also recommend that you find a program that's able, in terms of an administrative endpoint, be able to allow you to track your staff members' training status. As Seamless, our education portal gives you that capability as well. So how many of you before an audit, go through a panic when you realize that, oh no, I don't have a certain certification for my agency staff. I'm sure they did it, but I just don't have that proof. With our education portal, what you're able to do is you're able to actually run a report at the ease of a button to see who did the training, who did not complete the training, and chase after the appropriate people. What it also allows you to do is it allows you to be able to actually click into your staff's profile and just directly print their completed certification out right there and then. So therefore eliminating all the steps that you had to do to track for that certification in the beginning. Lastly, you want an education system that allows your staff to be able to book their own appointments, therefore giving your staff the autonomy to be able to see their own schedule and when they're free to book those training sessions, either it be in person or a virtual training session. So I think this now brings us to the end of our presentation. If you can just go one more slide. Next. It brings you to our references that we use for this presentation. So just to summarize, our presentation today was talking about how technology as a whole can help with a lot of the challenges that our agencies in the DSO sector may experience. Ultimately, what we're trying to convey is by using technology, you really can remove a lot of the technicality part of it, while increasing your ability to actually be hands-on more with the clients that you support, so you can support them in achieving their goals in life. And as an agency as a whole, you're then able to have a far greater reach and increase your capacity in order to support more future clients that might be interested in your services. So that concludes our presentation for today. I do apologize. There was a lot of technical difficulties this morning, but I will pass the mic back over to the audience to see if there's any questions that you had for us to answer.
There's a few questions in the chat here, Helen. Did you want me to go over it here?
Yes, please.
All right. Question number 1. You mentioned there's a client member photo option for the blister pack. Is there a similar option for medication pouches?
Yes, so that's a great question. So I'm just going to show, I don't know how big the screen is. So there is a photo option for the blister right here, and it also appears on every single one of the blister cells. For the pouches, unfortunately, the pouch itself doesn't have the capability to have a photo. However, we have complemented that with free dispensers that has the option for you to include the members' photos once we have consent. And not only will that be on the dispensers, it's also on like the pharmacy's profiles themselves. It's always nice to see how our clients look like. So that's also an option as well, and those are completely free of charge.
Nice, thank you. Second question for you, Helen. Who can sign up for the compliance packaging? Is there an additional charge?
Yeah, so anyone can sign up from our group homes. Anyone can sign up for the compliance packaging just because of all the reasons we had listed throughout the presentation, and that really helps our homes with focusing on making sure that the medication administration piece doesn't have any errors. So there's no additional cost to it. We also can strip together like over-the-counter medications as well. So you're not having to now juggle between different medication jars in addition to the strips. So everything's just all in one place for you.
Gotcha. Would agencies that don't fill their clients' medications through Seamless be able to use the education portal?
Yes, so for our clients that fill medications through Seamless, the education portal is a complimentary service that we provide. For agencies that don't fill with us, you can still access the portal. I believe there is a fee associated with it, but I think Amit can touch upon special. I think we have a promotion right now for the Community Living Ontario community in order to have, I think it's a 1 year free access to some of the courses. Correct me if I'm wrong, Amit.
Yep, that's right. For 1 year starting this summer, so in June, the CLO agencies and other partner agencies can access the education portal free of charge, and it's equivalent to about $3,000 per year to educate the team, and it includes like all their training needs, like certifications with regards to the controlled acts, medication management, and so on. So it's if you'd like to learn more, we'll follow up there. Ronald can follow up with an email, and they'll actually share with a link that you can just click through and fill out your information, and we can we'll connect with you to take advantage of that promo. All right. Question number 4: how often are the trainings held?
So our trainings are held once a month. However, those are just the standardized times that we have set for trainings, and they usually are a first come, first served basis. However, we are also agency specific as well. So depending on which package you have chosen, you may be allowed to book more trainings in. The way that we do them that we found is very helpful sometimes is we have mixed training sessions. So we actually have training sessions where caregivers come from different organizations, and it's actually an amazing network, because when we find that, you know, maybe this home has experience doing this certain way, and then another caregiver chimes in, oh, well, in our home we do it like this way. And so then we're actually able to have a nice discussion with the pharmacist to have knowledge sharing once again. So both of those options are available. There's one where if you just want your agency, just your agency staff to attend, that's an option. There's one where we have mixed courses, and depending on your package, if your package allows for you to have more training sessions, then you're able to book more training sessions throughout the month. I think you're muted, Ahmed.
All right, thank you there. Next question: are there a certain number of prescriptions I need to have before I can access compliance packaging?
There isn't a minimum number at Seamless, at least for you to have compliance packaging. We have clients who are on 1 or 2 medications, so there is no minimum.
Are you able to strip OTC items into the compliance package?
Yes, so that was, we're able to have over-the-counter medications provided that we're able to source them from our warehouse, but those will then be stripped into your compliance packaging. And if it's over-the-counter medication that's not covered, this really helps a lot of times with agencies, specifically if they're just on a trial basis, they're only on the medication for 2 weeks. The doctor just wants to see how effective it's going to be. You then don't have to have like the cost associated with having to purchase an entire full bottle. You would just purchase it for the 2-week supply that we supply you.
Here's one for you, Jennifer. What is the Seamless Home Portal? What other capabilities does it provide other than the education portal?
Yeah, so we actually have an EMR now. So we've been working on this for the last year or so, and we have a few agencies who are piloting it. So we do now have an EMR, and we also have some progress noting. We have the ability to track vitals, appointment tracking, and reports as far as like missed medications and any administrations, injection reports, and things like that. So we have also, there is some, you're able to track errors on there as well, like any pharmacy related errors, you will be able to track that through the portal. and manage your team as far as, you know, because we know in the DSO sector, staffing can be a little difficult. So being able to create your own team so that they have access to the portal, to access that training, and being able to track team members and which homes that they're providing care for and things like that. So just a lot of management of your team can be done through the portal as well. And yeah, like I said, we're continuously always improving this product and are getting feedback on which features they like, you know, organizations would like to see next. So we're always building upon what we have today. So.
When using Emars, are other pharmacy provided forms also electronic, such as narcotic count sheets and monitored medication records, EDIC? This one's from Susan. Did you want me to repeat that?
I'm not really sure. I'm just not really sure if I understand the question. I'm looking at the chat. Helen, do you understand what they're asking? So when using Emars, are other pharmacies provided forms? So are you saying to use the Emar in conjunction with a different pharmacy?
I think I know the question here, Jennifer.
Okay. Yeah.
So, yeah, the various forms that you would find from the pharmacy, they're provided electronically, or an electronic format would be done through the portal. For example, like narcotic, like inventory, returning narcotic medication, it would be done through an electronic form. Monitored medication records, I'm not sure what that refers to, Jennifer.
That might just be like your Mars, right? I think it's like looking at the medication administrative record. Correct me if I'm incorrect, but that's what it kind of looks like, and that's where the EMAR comes into place, where you're able to electronically document what you would normally document on your medication administration record, and having that readily available.
Yeah, and there will be reports as well, so you can always backtrack and look at the past. So, and it'll always be stored on the application.
Right. And how about narcotic count sheets in particular?
So narcotic count sheets, as of right now, we do not have that electronically. That is something that we are aware of, and we are building into the software. So that is a feature that will be coming in the future.
Right. And again, like if you guys need more information, you could do a deep dive on the portal and its offerings and what kind of electronic workflows are available through Jennifer. So she'd be happy to set up further meetings there to dive into that. Susan, I hope that was enough information, but feel free to throw in another question there and we'll get back to you. All right, next question.
Yeah, even before Susan, I think there was one from Chris I can see here. Can you speak to the cost of using Seamless Care?
Okay.
Maybe I can answer that question, take a stab at it. With majority of our agencies that we have transitioned to Seamless, they've actually seen a reduction in total costs that they've had to expend, and that's a number of reasons. We offer a list of complementary minerals and over-the-counter products. Because we understand that those in the DSO sector, oftentimes they're financially they don't have a lot of finances. So we do that in an effort to be able to make sure that they do have the vitamins that they do need. In addition, we have a very thorough process when we transfer clients in to actively look to see if there's other alternatives that we can get the medication covered, either through an exception access program, through a limited use code, or switching them to an alternative that is covered under their insurance plan. So we do a lot of those footwork to make sure that at the end of the day, when we are charging your client for a medication, it's because we've exhausted all those options. So a lot of times, if you transfer to Seamless, you would never see an increase in the cost. Likely it will stay the same, but a lot of times we actually see a decrease in the amount that you actually have to spend.
Thank you, Helen. And then Tula asked, will the deck be provided after the presentation? And yeah, I believe so. Ronald will share that through an email to everybody. Moving right along here, a question from France. Is seamless pharmacy services offered throughout Ontario or only certain regions? And I can answer that one. So currently, seamless pharmacy services is offered throughout Ontario. The dense populated areas, like the cities and Core 3 region, Toronto GTA, as well as London, Waterloo, and Kitchener, these areas we're able to do through our own delivery infrastructure. However, for rural communities that are further up north, we partner with third-party couriers such as Canada Post to help with that last mile of delivery. So, and then all the other services such as like the portal, the education, that's all part of the service. So that doesn't change. If that answers your question, France. Did you want to add to that, Helen, at all? Or?
No, I think you had that covered. We currently, we have a pretty large catchment area within Ontario currently, but as Ahmed has said, those are currently being delivered by our own in-house drivers. But once we expand a little bit more, we might be using more third-party carriers to help with the delivery of the medication.
Right. And how are the medications delivered and how often? It's a question from Kelly. We touched on this. Helen, did you want to dive deeper?
I can dive deeper into it. So medications are delivered, and the frequency really depends on the proximity to Seamless. So majority of our clients receive weekly deliveries and bi-weekly. So those are the two main ones that we offer. However, we also offer every 3 weeks, every 4 weeks. So again, it depends on how close you are to the pharmacy. If we're using, for example, a third-party provider, then we may lean towards providing something like a 2-week, just because normally third-party carriers aren't able to do same-day deliveries. And so with that limitation, we normally like to provide a little bit more medications just to make sure that you're never without medication before we're due to go back out again.
And if you would like to take a specific look on how it would work with your organization, you can always book a call, and Helen and the transition team can give you a proper, exactly what that medication delivery would look like for your organizational needs. Okay, I believe that is all the questions. All right, thank you everybody for taking the time to be with us here today. We hope you learned a lot as much as we've enjoyed being here. Helen, Jennifer, thanks so much for your time as well. And Ronald and Heather, thanks for having us here. Well, we look forward to hearing from you. If you'd like, just Ronald will be following up with an email with the slide deck as well as our contact information. And you'll be able to reach out to us that way. Otherwise, thank you so much, everybody. Take care.
All right, have a good day. Bye.
Bye.